And we're on location today at Eastern Orthodontics and Pediatric Dentistry. A couple of Greenville icons right here, Dr. Jasper Lewis and Dr. Lee Lewis. Gentlemen, thank you for having us. Good to see you.
Good to see you. Thanks for being here.
Jasper, let me start with you. Let's talk about the history of this practice. People know the name Jasper Lewis in this town for all the things that you've been involved in and done over the years, especially what you've done here with children's dentistry.
I think you just called me old. But we've been here, we opened the practice in 1973, and we've been at 2 other locations, and we've been in this location since 2000. And we have several dentists in practice with us, and our objective is to improve the dental health of all the children in Eastern North Carolina.
And the legacy continues with Lee. And Lee, for people who don't know about the practice here, now you're an orthodontist and also do some pediatric dentistry, but tell us a little bit about your role here and following the legend.
Well, I'm dual trained in pediatric dentistry and orthodontics, and when you're treating children, especially, orthodontic care definitely plays a role in their overall oral health. So we are able to follow these children from a young age up through adolescence and take care of problems that we see as they come along. But orthodontics, we also take care of adults here as well. So we're able to take care of families down on the other side.
Yeah. And of course, this is the site here, right in this room, where the Give Kids a Smile Day idea was born and continues to this day. And Jasper, it's about treating children in Eastern North Carolina. The Give Kids a Smile Day event is, but that's also what I know you have a passion for that and for the children and people of Eastern North Carolina.
Henry, these are my people. I'm from Eastern North Carolina. I was born here. I wanted to die here when I finally go. And my biggest goal is to see that every child in Eastern North Carolina has good dental health in the future. And we should be able to do it because we have the technology, we have the know-how. It's just a matter of getting commitments. And you have helped us bring in people who make decisions at the state and national level to see what the need is. And that's what we've needed all along. And by having them look and see, hopefully they'll be willing to help us help the future of the world, which is our children.
And of course, you can get medical care and dental care in a lot of places, but getting it from people who care about the patients, I think that's what people will say about this practice and over the years, the commitment that you guys have made to Eastern North Carolina. Lee, talk about the philosophy a little bit for this practice, Eastern Orthodontics and pediatric dentistry.
Well, what we like to say is that we're able to see these children from birth, and we'll see children right on through, usually their college years. That way we're able to follow them over the years. We're able to know the issues that they have and, develop a bond with those patients. Not all dental care is easy, and not all the things that we have to treat are going to make the people very happy about what they have to go through. But what the final result is we're trying to make everyone more healthy by taking care of the dental problems that we see and try to prevent as many as we can. And that's part of what our philosophy is prevention as much as treatment of taking care of the problems.
And children's dentistry is a specialty, right, Dr. Lewis? There's additional training generally for people who see children's, not always, but you have that extra training, and I know some of the other folks here do for pediatric dentistry.
That's correct, Henry. After dental school, you can go straight out into practice. You've had training in all the different areas of dentistry, but pediatric dentistry requires 2 more years of training or 3 more years of training in certain schools, depending on what you're doing. And so does orthodontics. And if you go back out, get the pediatric training, you come back, then you, just like pediatricians, basically the training pediatric dentists have is comparable to pediatricians. You come out of medical school, you can practice family medicine, but to be a pediatrician, you have to go back for specialty training because that teaches you how to deal not just with the normal healthy situations, but with the special needs that people have.
All right, and Dr. Lewis, Dr. Lee Lewis, people who are looking for a dentist and need a dentist right now, is it as simple as just calling and making an appointment?
Absolutely. Our office number is 752-6188. We have a website as well, www.eopd.org. We can be contacted on that as well.
All right, very good. So if you need a dentist, a pediatric dentistry, and orthodontics for adults and children, this is the place, right?
Absolutely.
Yeah, absolutely. And of course, Jasper told me not to say this, so I want to make sure that I say it. But I can tell you, without Jasper Lewis, the East Carolina University School of Dentistry would not have happened. Jasper, I've always said that you haven't gotten the credit you deserve for that. You won't take any of the credit, but everybody knows that it's true. When that fight took place and we finally got that dental school at East Carolina, you were really the reason.
Henry, it was a team effort of a lot of people, and you were one of the leaders in the news media, and you know it, and I know it. But it was a team effort of a number of people right here in Greenville that met, and also people in the legislature that cared about Eastern North Carolina came together. And this was just like getting the med school. We didn't have unanimity around the state, and Eastern North Carolina has had to struggle to get everything we've gotten. But we now have a dental school, and it's on its way. I was told by one of the people that came in and did a feasibility study that this will put North Carolina at the pinnacle of dental education.
That's great, and you do get the credit, whether you'll accept it or not. Dr. Lee Lewis, Dr. Jasper Lewis, Eastern Orthodontics and Pediatric Dentistry.